You may have heard that you have to get your heart rate up when you're exercising in order to have a stronger heart. Is this really true? Not really. There are three parts to exercising to have a stronger heart to prevent heart disease. The first is heart strength. Cardiovascular exercise, or cardio, is the type of exercise that strengthens your cardiovascular system. Yes, your heart rate goes up during this type of exercise, but that's not what makes this the type of exercise that strengthens your cardiovascular system and prevents heart disease. It's the way that it makes your heart muscle stronger. It does that because during this type of exercise where you're moving continuously using large muscle groups, you're increasing the circulation through this system. More blood circulating through that system means more blood comes into the ventricles and the chambers of your heart, which means there's a little stretch and the muscle has to pump harder. That makes your heart a stronger pump. This is why heart rate is not the ultimate guide to whether exercise is improving your cardiovascular strength. The second reason is your cells get better at turning fuel into lasting energy. This improves stamina, and that means everything you do is less work for this system. And the third way is by putting less strain on this system. The stress state strains your cardiovascular system. When you're in this stress state, your body puts more fats and sugars into your blood system. What also happens, though, is that your blood vessels become more rigid when you're in a stress state. That combination is what leads to cardiovascular disease. You've got more sticky stuff in your blood, and you've got blood vessels that are not as resilient and creates more pressure and wear and tear on the inside of your blood vessels. So it's that sticky stuff is more likely to stick to your vessels, causing cardiovascular disease. So we don't want to make exercise, any form of exercise, stressful, because then it doesn't get you out of the stress state. It just adds to more stress. So we want to curate cardiovascular exercise and every type of exercise to cure that stress state. The key is making sure it's not exhausting. It doesn't have to be high intensity. If the intensity is so high that it makes you exhausted, it's adding to stress. We don't want it to be a state that you're worried. You're worried about having a heart attack or worried about injury. You don't want it to be an embarrassing event, that you're embarrassed about how your body looks or having two left feet and not being able to keep up with a Zumba class. It needs to be in a pain-free range in terms of the type of exercise you're doing, the intensity, the duration, the frequency. And a key part to that is staying present, using mindfulness, so that you're not distracting just to get through, but you're using this time to reconnect with your body, to listen to it, to take care of it. Learn more about this whole person science-based approach to exercise at exercisingwell.com.